Hi, welcome to this presentation of the muscles of the abdomen. My name is Kevin Johnson. I'm a student here at Concord Career College in the PTA program, cohort number 7. We have 3 objectives today. Our objectives are going to be identify the different muscles of the abdomen, identify the properties of the muscles, and identify the exercises used to strengthen the abdomen. Before we begin, can anyone name any muscles of the abdomen that you might know beforehand?
Obliques.
Obliques, okay. Actually, there's 2 different types of obliques, which we'll be going over here, external and internal. Anyone else?
The rectus abdominis.
Rectus abdominis, okay. Those are what everyone always wants to get the most. So take a look at that here. So you see from our picture here, the different muscles of the abdomen. Transverse abdominis, these are actually the most interior muscles of the abdomen. And then the rectus abdominis, like you said. And then we got the obliques, internal and external. All right, as we're waiting for this to load up here. First, we're going to talk about the transverse abdominis. These are the deepest of the abdominal muscles, and they actually do wrap around the spine to provide support and stability for the trunk and the core for every person. And then also the rectus abdominis, again, what's known as a six-pack, what everyone wants to get. This locates the front wall of the abdomen, the muscles that are the most prominently seen when you're out and about doing your business. All right, the external abdominal obliques. These are the ones that they're coming from underneath your armpits and they're going down to your waist. What gives the men their V-like shape when they're working out or starving themselves. No carbs, get those nice abs going on. And the internal actually run parallel but in the opposite direction to the external obliques, which we'll get into. They originate at different places and insert differently. We'll get into that in a few slides here. All right, so we're going to be talking about the properties of the abdominal muscles. We're going step by step, muscle by muscle. So first, again, we're going to talk about the transverse abdominis. Wraps around the spinal column, like I said before, and provides support and stabilization. It's important in therapy because of that support and stabilization. Because someone can have strong abdominal muscles, but if they're not working their entire core and they don't have that stability around their spine, it can cause back problems, back pain, all sorts of different issues that we're going to have to address as physical therapy assistants working with our physical therapists. Okay, so the rectus abdominis. This is what's known as a flexor. This is what you use when you're sitting up off the couch after you've been binge watching your latest show, Orange is the New Black, or whatever you're watching, and you're getting up and you feel that flex and it's kind of tight, and you're using those rectus abdominis muscles to bend your trunk, flex it, and stand up. It originates in the superior edge of the pubis bone and the symphysis, so it starts actually down in the lower part of the abdomen and works its way up. The insertions for it are at the xiphoid process and the costal cartilage at the 5th and 7th through the 7th ribs. So it's going upwards. All right, the external obliques. This is also a trunk flexor, but it also helps to bend and twist the body. So it bends the body ipsilaterally. So when you're bending to the left, you're using your left oblique, and to the right, vice versa. But it rotates the body contralaterally. So when you're rotating, you're going to the right, you're using your left oblique. It also provides stability coming down along the sides of the trunk. It originates in the lateral ribs 5 through 12, and it inserts into the linea alba of the abdomen, the pubis, and the iliac crest. So this is going top to bottom. All right, the internal obliques. Again, they're trunk flexors, and they have the same properties as the external as far as bending and twisting, going ipsilaterally and contralaterally. They still provide stability, and these are going in the opposite direction. So they originate in the iliac crest, the inguinal ligament, and the thoracolumbar fascia. And it inserts into the costal cartilage of the 8th through 12th ribs and the linea alba. So again, it's providing support, but it's going transversely to the external obliques. All right, there are several nerve innervations inside the abdomen because your nerves go all the way from your spinal cord down your legs, and so it's passing through the trunk. So I'm just going to touch on a few of those today. Again, we've got the thoracoabdominal nerves. They go through the muscles of the anterior lateral abdominal wall. So what's in the anterior abdomen? Which part is anterior?
Front.
The front. Okay, so this is what's giving you the sensations in the front of your stomach. It's giving your muscles, attaching to the muscles in the front. The subcostal nerves, these are in your abdominal wall muscles and the skin. Iliohypogastric nerves, they supply to the internal oblique and transverse abdominis muscles. So these are going deep, hitting the muscles deep inside your core. And finally, the ilioinguinal nerves. They innervate the scrotal skin in men, and labia and majora in women, the area over the pubic bone, and the medial portions of the thigh, along with the internal oblique and transverse abdominis muscles. So these nerves are going all the way from your core down into your groinal area. So, that. And next we're going to talk about some exercises that we use to strengthen and help rehabilitate people that have had stomach issues. So if I can get my demonstrator to go to the table behind you.
Oh.
He's going to be up on the table, and we're going to go over 4 exercises that you can use to strengthen the abdominal muscles. So the first is the crunch. You're going to lay in a supine position, legs bent at a 15-degree angle, and you can either place your hands behind your head, or if you might have had a neck injury and don't want to put stress on your neck, you can cross your hands in front of your chest. And you're going to go up approximately 8 to 10 inches off the ground, and you're going to hold it for a count of 3. And then slowly lower yourself back down. As with any exercise, control is key. You want to control yourself through it and not hurt yourself by going too fast or dropping down and hitting the ground too hard. The next is low ab leg raises. Pretty much the same starting position, except your hands can be down by your side for support and stability. And you're going to go with a 15-degree angle in the legs. And in an arcing motion, you're going to bring your legs up approximately 10 inches. And you're going to bring it back down slowly again after a count of 3. And again, you want to do controlled movement here. You don't want to just be flailing your legs around as if independent from your body. And usually we'll do that for like repetitions, 10 repetitions in a set, 3 sets of 10, or until the patient feels pain. Because if the patient starts feeling pain, you want to make sure that you stop and rest and figure out what's wrong. Next is the twisting sit-up. Same position, except you're going to have your feet flat as you can get it. And as you're coming up, you're going to go all the way up when you're sitting up with your hands behind your head, and you're going to touch your right elbow to your left knee, back down, and then alternate the other direction. And that'll be 1 repetition. And the final exercise for the entire core is the plank. We're going to show you the plank on the elbows to start with. And you're going to be on your elbows, raise your body up with your weight supported on your elbows and your toes. You want to keep your body in a generally straight line from your back down to your heels. And you'll hold that for the prescribed amount of time, usually 30 seconds to a minute. And you're good. Thank you very much. And that concludes our presentation for the day. I had a couple references that I want to cite. We have Human Kinetics, The Functional Anatomy of the Core of the Abdomen, and Terfera David, and Nerves, Blood Vessels, and Lymphatics of the Abdomen from dummies.com. Thank you for your attention today.